Hello, good morning, dear friends. I'm your principal. Today I will teach you about crisis intervention. Before also, I already teach about psychiatric emergency. So, what is the definition of crisis intervention? A crisis is an overwhelming reaction to a threatening situation in which a person's usual problem solving strategy failed to resolve the situation, resulting in a state of disequilibrium. So, type of crisis. First is the developmental, or you can say maturational crisis. Predicted times of stress in everyone's life, which occurs in response to a transition from one stage to another, the life cycle. Example, Erikson stage going from industry to identity. So this is developmental or maturation stage. According to the maturity, this will happen. Situational crisis, second one, situational crisis, occur in response to a sudden unexpected events in a person's life. The critical life events revolves around the experience of grief and loss. For example, loss of job, divorce, abortion, death of a loved one, severe physical or mental illness, etc. If it is happen according to the situation, that is situation crisis. Third is the adventitious crisis. Are not part of everyday life. They are unplanned and accidental, resulting in traumatic experience such as natural disaster, hurricanes, flood, fire, earthquakes, etc. Nutrition, national disaster, for example, war, riots, etc. Crime of violence, child abuse, rape, assault, bombing in crowded areas, etc. And nowadays it is a corona crisis. No one is going to ready to go outside, and there is a problem, financial problem also we are facing. How we will intervene the crisis? Crisis intervention. How we will overview the things? First, crisis occur in everyone. Nowadays, that is corona crisis. You are facing everyone. Not necessarily pathological, may encourage growth and change. Time limited to period 4 to 6 weeks except death. A person perception determine the crisis. So, crisis, how crisis intervention, balancing factor, what are the balancing factors? First, good outcome, perception of events, realistic situational support, adequate, and coping mechanism, adequate. No crisis. You know also in the beginning also, so many times I have explained you about there is a 3 balancing factor, and one is the perception of the events. Second, crisis development. Perception of event distorted, situation support inadequate, coping mechanism inadequate, that crisis is happen. You can see the phases of crisis. If stress comes, there will be an increase of anxiety. If there is an anxiety, usual coping mechanism ineffective. If that mechanism is ineffective, not working, then trial and error, there will be a solution. If we are not getting any solution, then there will be a severe anxiety. Or there will be, if there is a severe anxiety, it leads to personality disorganization and crisis will happen. Or you can say usual coping mechanism, new problem solving solution support. If mechanism, that problem is solved and we are able to cope that situation, then new problem solving solution and support, anxiety and pre-crisis level of functioning. If there is a not properly solved the problem, then there will be a pre-crisis level of functioning. How we will assess the crisis? This is crisis intervention. How we will do assessment? First is the coping mechanism. For example, suicidal plans, what helps you feel better, etc. We have to ask the question. Support system, with whom do you live with? Who is available to help you? Who is most helpful, etc. We are asking questions. Mental status, previous history. After checking mental status examination, we will know about the history of the patients. Identify client strengths, and we can see what is the weakness and strength of the patients. Self-assessment, nurse's feeling. Then nursing diagnosis. Number 1, risk self-directed violence, chronic low self-esteem, hopelessness, powerlessness, severe panic level of anxiety, disturbed thought process and sleep deprivation. That person not able to sleep. Then how we will plan to intervene that crisis and outcome identification. How we will do it? First is the assist the client in setting realistic goal to return to the pre-crisis level of functioning. Second, establish desired outcome criteria for the client using the problem-solving approach. Here that person have to use the problem-solving approach. Implementation. How we will implement the things. Assess for any suicidal, homicidal thought or plans. We can assess like that. Take initial step to make the client feel safe and lower anxiety. And third is the safety intervention to prevent violence, suicide, angry, aggressive client. Fourth, listen attentively and encourage the client to discuss the crisis situation and facilitate the verbalization of thought and feeling. Number 5, creative and directive approach needed. Initially, nurse may make phone calls, arrange babysitters, find shelters, contact social worker, etc. Nowadays, Corona, how they are approaching, how they are implementing, how they are separating the people and how they are giving treatment to the people. Crisis intervention. Sixth, use problem-solving approach, identify needed social support with patient input and mobilize the most needed first one. We can make one list and according to that we can, whatever is needed, that first you have to solve it. Identify and work to increase needed coping skills. Problem solving, relaxation, assertiveness, job training, newborn care and self-esteem, etc. Then plan with patient intervention that are acceptable to both. We can make plan like that patient also will be agree and you will also be agree for that. And then evaluate a plan and instruct patient with alternative plan if needed. So these are the resources and you can see from those books I have taken this topic. And now thank you very much. Maybe you have understand the crisis intervention and how to maintain the crisis.